Good morning. Colleagues, good morning. Our Second Chance Act Conference has officially launched. Whether you're joining us live and in person or viewing us over the web, your participation, your research, your programs, your support are vitally important to the work of Reentry. A warm and grateful welcome to each and every one of you. I am Stefan LoBuglio, Director of Corrections and Reentry for the Council of State Governments Justice Center. At CSG, I oversee the National Reentry Resource Center, which brings you this conference. We thank the Department of Justice, Bureau of Justice Assistance, for their partnership and their funding for the National Reentry Resource Center. As we begin our Second Chance Act Conference, today also marks the culmination of the Justice and Mental Health Collaboration Conference, which began on Monday. For the past 2 days, our colleagues have been keeping these seats warm and energizing our conference space with their focus on reducing the number of individuals with behavioral disorders in our nation's prisons and jails. Our ranks this week have been increasing, from 100 or 200 on Monday to several hundred more on Tuesday, and now we are gathered in a crowd of almost 1,500. Today is the day that justice and mental health and second chance intersect. We know that the link between behavioral disorders and reentry are inextricable and present a staggering problem. But because of all we've learned, because of our commitment and our collaboration, we're not daunted. You'll find both optimism and problem solving continuing in the workshops offered over the next 3 days. So who's here today? Sitting next to you, you have deeply committed federal government leaders. You have at least 2 Department of Correction secretaries. You have noted academics. You have talented policymakers, practitioners, and advocates. In short, you have nearly 1,500 of the best minds and the most fiercely devoted professionals joining together to improve the outcomes of the millions of individuals leaving our prisons and jails. We particularly welcome our Second Chance grantees who labor on the front lines of reentry. We welcome grantees from years past and congratulate our newest cohort of 45 grantees. Among them, to name just a few, we have a reentry program in Guam. We have a supervision project in Alabama, a Latino youth mentoring program in Nevada, a tribal reentry program in Washington State, a 4-H family strengthening program in Maryland, and a computer tech training program in Michigan. They join a proud rank of 700 grantees who have collectively received nearly $500 million in funding since the passage of the Second Chance Act grant in 2008. We have learned a lot from that federal investment. It is inspiring to me to see this new knowledge begin to permeate our field and to infuse your grant programs and to witness a new consensus taking shape. We agree on the need to assess our population, to target those with the highest risk needs with intense evidence-based programs and supervision, to monitor the quality and fidelity of our programs. And we have a focused, even maniacal need to measure the results and to reduce recidivism. That's the double R word set that you're going to hear in almost every plenary and every workshop. Stated starkly and practically, reducing recidivism is our charge. Stated from the heart, our charge is to help people like the woman who came to the pre-release center that I oversaw for 10 years. She came to attend a support group. She shared how she'd finally gotten herself clean, got her kids back from foster care, had herself a home, got a job as an assistant manager at her Starbucks. With tears running down her cheeks, she talked about the love for her husband, who was incarcerated in our facility. But as much as she loved him, she was terrified that his return would upset the fragile balance she'd worked so hard to achieve. We're here today to help that woman, her kids, her husband, and all incarcerated individuals who'll be returning to families and communities just like her. Every single one of you has an essential role in demonstrating the effectiveness of reentry programs and strategies. Thank you for your work, for being here today. Let us approach this conference as a way to learn, retool, and engage with each other in the vital work that lies before us.